This is a talk just basically looking at the effects of umbilical cord mesenchymal stem cells on neural repair. Just a little bit about me. I founded Mall Stem Cell Research Institute primarily because I think we need to be bringing these therapies to our patients, and so it takes rigorous studies in order to get there. I'm also president of the American Academy of Stem Cell Physicians. Proudly enjoyed that role. For a long time, the central nervous system has been considered unable to do any kind of meaningful neural repair. And although pharmaceuticals can reverse symptoms or slow progression of disease, they fall short of being able to repair neural tissue and even replace it. This is where stem cell therapy aims to shift that paradigm. There's basically 3 types of cells that are used in neural repair. We can use mesenchymal stem cells, neural stem cells, and induced pluripotent stem cells. With induced pluripotent stem cells, you're using the subject's own stem cells and reprogramming them to a pluripotent state so that they can form any of the 3 germ layers. I think this area of medicine is very promising. The biggest concern there is of tumors. The second is neural stem cells. These are found in the subventricular zones of the brain and in the hippocampus. These neurons can directly change into astrocytes and oligodendrocytes. The difficulty with this research in both of these areas is the immune suppression required. In my small research center, we don't have the infrastructure to work with those 2 types of stem cells, but we do hope to expand to that. We primarily work with umbilical cord-derived mesenchymal stem cells. And although these cannot turn into neurons themselves, they do have a lot of neuromodulatory effects. Mesenchymal stem cells that we tend to work with come from 2 sites. This is not used for the IV treatments that we do, but you can take it from the matrix. And this is a more gelatinous type of product. It's really good at scaffolding, really good for joint injections with rebuilding of cartilages and tendons. For the purposes of today's talk, I'm going to concentrate on cord blood mesenchymal stem cells. When we take the stem cells directly from the cord blood, it's rich in hematopoietic stem cells, mesenchymal stem cells, and very small embryonic-like stem cells. There are a number of mechanisms by which mesenchymal stem cells support and help with neural protection. First of all, they have the ability to shift microglia from a pro-inflammatory M1 state to their M2 anti-inflammatory state. They release a number of growth factors such as brain-derived neurotrophic factor and VEGF, and these can help greatly in angiogenesis. They have anti-apoptotic effects and also protect and restore the neuronal signaling by reducing oxidative damage. I have seen firsthand on different things that I've done their ability to cause remyelination and improve functional recovery. This is looking at microglia in brain tissue that it is showing swelling versus non-swelling. So the left 3 slides, A, B, and C, show the microglia in their healthy state. There's very little APP staining because there's no axonal damage in those areas. The microglia are in their relaxed M2 state. When we look at the slides on the right with brain swelling, you'll see quite a bit of axonal injury depicted by the APP staining. In that state, the microglia become clumped and they move to an M1 pro-inflammatory state. So the importance of this slide shows us that microglia are not just innocent bystanders during disease. For patients with diseases like Parkinson's and Alzheimer's and such, they will move to a pro-inflammatory state, causing worsening of axons, increased nerve damage. This is another study done in mice. So this is showing the microglia in their inactive M2 state with staining. When we add lipoprotein saccharide, we get quite a bit of clumping of the microglia, showing them in their inflammatory state. If we add a mesenchymal stem cells, it moves them back to that M2 anti-inflammatory state. Mesenchymal stem cells release a signaling molecule called CX3CL1. And so if we block the receptor for that molecule, you see it move back to the pro-inflammatory state. So we can see that mesenchymal stem cells have the ability to shift the microglia in the brain from an inflammatory state to an anti-inflammatory state. When overacted in an inflammatory state, we're going to see more disease. There's a number of studies that have been done using umbilical cord-derived mesenchymal stem cells. 3 of note include a 55-year-old man, 6 months post-stroke. His lesion was measuring 3 by 2 centimeters. He was given IV umbilical stem cells, 200 million cells, times 2, 8 days apart, caused significant shrinkage of the lesion, and also allowed him to return to work. In this study, they did 10 adults with vascular dementia using IV human umbilical cord-derived mesenchymal stem cells. In that study, they were using 100 million cells times 3 every 3 months and showed significant improvement in mini mental status exams and Barthel index. Last study of note involved 10 adults with MS using IV umbilical mesenchymal stem cells. They did intrathecal to start with, and then they ran IV every 3 months for a year, 10-year follow-up. 9 out of 10 had significantly diminished relapses in their MS. We all hear about the possibility of tumors, but the reality of it is when it comes to umbilical cord mesenchymal stem cells, there's no study that they've shown that has resulted in reporting of a tumor formed by umbilical cord mesenchymal stem cells. The most common effects are at less than 3%, low grade, honestly, sometimes it's high grade, but fevers within 24 hours post-infusion, local site reactions, very uncommon to have vascular occlusion, thromboemboli, infection. So this is a case study that we did. This patient had thimerosal in some of the preservatives used. He was a veteran. So when I met him, he was 63 years old. This is how he looked. Thimerosal is often used in the preservative to suspend immunizations. It's not often used anymore, but he had received some immunizations overseas that had thimerosal, which is basically ethyl mercury. It has the ability to cross the blood-brain barrier. He had done a lot of treatments before I met him. He'd been in this state for 8 years. They had done chelation therapy, they had done every medication known to man and could not reach him. Looking at a PET scan, we can get PET scans with amyloid staining. And it really doesn't matter if the Alzheimer's is due to metal toxicity or due to autosomal dominant gene mutations. You'll see an increased amyloid plaques. And there is some amyloid plaque in a normal brain, in his case very heavy in the frontal and temporal areas. We followed global assessment score because he was so non-functional. There was no other real scale that we could follow very well. So with global assessment score, there are basically 4 functional domains that are followed: cognition and language, motor functions, social interaction, and daily function. And each of these domains is scored on a score of 0 to 25. So in his case, he was nonverbal, minimal eye contact. He was alert but unable to follow commands, had no vocalizations. And so he received 1 point in this area. When it comes to motor function, he was not bedbound, but he had limited mobility. It took 2 people to move him into a wheelchair. He had a lot of posturing of his hands, was unable to walk, so he was given 6 points in that area for a total score of 7. From a social interaction standpoint, he had no social awareness, no recognition of family. These areas go anywhere from total dependency on functional ADLs, for instance, to being independent, having normal relationships, etc. But in both of these areas, he scored 0. So his global assessment score was 7. For the treatment protocol, we basically, this is out of order actually, we gave him 25 milligrams mannitol via IV over 15 minutes. And then we did a slow IV push of 200 million umbilical cord derived mesenchymal stem cells and 2 trillion exosomes. He was given this treatment every 3 months for 1 year. The mannitol has the ability to open up the blood-brain barrier, allowing mesenchymal stem cells to penetrate at a higher penetration. There's been studies that show that it will increase mesenchymal crossing the blood-brain barrier by 60%. This is how his PET scan looked after. So, some improvement here, a little bit of atrophy, some improvement here, and then other areas that were more intense. But in my mind, it shows that there is the possibility for neuroplasticity, there is a possibility of reducing amyloid plaques in our patients, and there is a possibility of helping them functionally. At 3 months, he was able to track with his eyes. He was walking with a 2-man assist. By 6 months, he was speaking 3 to 5 words. By 9 months, he was speaking more and starting to interact. He started interacting with his grandson. And every now and then, his wife would call me, and she'd say, "Dr. Mall, can I put you on FaceTime?" And I'm like, "Sure." And then she'd show me, "Look, he's talking to his grandson." And one day she called me and she goes, "Dr. Mall, can I put you on FaceTime?" And I said, "Yes." And she went like this. He said, "Today, John went, I am John Shoemate." The incredible thing to me is he started to have awareness of who he was and who his family were. And by 12 months, he was able to walk independently. So this is him at 3 months, 6 months, starting to show more expression. Here he is by about 9 months, starting to, and the interesting, look at his face, how much younger he seemed to kind of anti-age even on the level of the skin. Here he is ambulating independently. As this kind of progresses forward, you'll see where he has some gross motor movement, but not much fine motor movement. But he's starting to, the very end of this on the original, it just takes forever, but he'll look up and smile, and you can see that he's starting to enjoy his environment again. And at 12 months, he started to have fine motor to the point where he can feed himself. And so they actually moved him. We moved him from a lockdown memory care unit to his home. And it was only a few months ago that she called me and said, "Hey, Dr. Mall, he actually went to the fridge and got himself something to eat." So anyway, it's been a lot of fun working in medicine in this realm. Couldn't ask for anything better. If you have questions, feel free to send me anything to my drmall@mallresearch.org site.